Okay, we're live on Facebook and recording our Zoom, so let's go ahead and get started. Hi, everyone. Thanks for joining us today. I'm Krista Gervon, Communications Director at Princeton Integrative Health, and I'm joined by Dr. Vin, and he is our Clinical Director at Princeton Integrative Health. And this is the InVINcible Health Series with Dr. Vin. So thank you all for joining us again. Today is a really important topic that we're going to be discussing, and very pertinent to everyone, I think, in this world, really. So we're going to talk about long haul COVID, what it is and what we can do about it. So without further ado, Dr. Vinny, can you give us an overview of what long haul COVID is?
Yeah, so long haul COVID is the terminology that's been given to people who have had an acute COVID illness. Sometimes very severe, hospitalized, sometimes not as severe, sometimes even mild, they say. But then either their symptoms don't ever really quite get better, and they just kind of persist and then sometimes worsen.
Okay.
Or sometimes people with mild symptoms, they might start out mild, and then over the ensuing weeks, other things may crop up for them. So, and it lasts usually, I don't think people have even decided when to make that cutoff for long haul COVID, but certainly, people are reporting symptoms 3 weeks later. It's probably still more of the resolving phase for most people, but certainly if you get into a few months,
Right.
I think most people would agree that 2-3 months you're probably getting into more long haul COVID symptoms.
And what are the most common of those symptoms that, to look out for if you're still experiencing them over, weeks and then months?
Yeah. So, I mean, for a lot of people, it's fatigue, sometimes very debilitating fatigue. Sometimes people are bedridden by this fatigue. But for some people, it might not be that bad. It might just be that, for weeks and months afterwards, they're just dragging. Maybe they can go back to work, but they're just dragging. They just don't feel their energy levels have returned to normal. Things like people might have new onset or changing patterns of headaches that could be related to this. Some people will even have intermittent fevers.
Okay.
Then GI symptoms might come in, the nausea, vomiting, diarrhea for some people. So, it's almost like you get a flu that just never quite goes away. But as I said, talking to people, some people find they're very debilitated. They're taking time off from work,
Right.
feeling disabled because of this. They just can't concentrate. A lot of people are complaining of things like difficulty focusing and concentrating, what some people might call brain fog.
Yeah.
They're having those long-term symptoms.
Yeah, and then this is important for those people who may live with someone with these, ongoing symptoms that may not, they might not understand that they even have long-term COVID, and they may not make the connection that it's connected. So these are really good to look out for if you are living with someone or you care for someone that is continuing to exhibit these types of symptoms over time.
Yeah, absolutely. Yeah. Knowledge is power, and right. Most illnesses we just tend to get better from, but with COVID, at the low end, they're saying that it's probably 30% of people, and then I've seen reports 50. When it first hit Wuhan, China, they were saying like 80% of people were having trouble even months later. So, I haven't seen reports as high as that recently, but the lowest I've seen is about 30%.
So it does affect a good amount of people. This is not, just an outlier type of thing. It's pretty common then.
Yeah, I would definitely say so. And I've seen it in people around me, talk to people who have had it. So definitely.
So what do you suggest the best way to maintain or manage those ongoing symptoms?
Well, it depends. We didn't talk about it yet, but there's almost like two groups, if you will. One group is the group that I just told you about, that probably their organs haven't really been damaged, their heart hasn't been damaged, their lungs haven't been damaged. you know, but they are having some type of ongoing inflammatory or autoimmune response.
Mhm.
But then there are people who maybe had more severe symptoms, and they may have even had some organ damage, some damage to the lungs or to their heart or blood clots or something like that. So there's probably, for the people who are in the more severe group and have had organ damage, probably those people should go to be evaluated at. There are many of the states now at the medical centers, these multidisciplinary, almost long, they're paid for people with COVID. They're bringing in all the specialties, the pulmonologists, the cardiologists, the neurologists, bringing them all together to provide multidisciplinary care for these sicker long haul COVID patients. So we would recommend that, if you were on a ventilator and, in the hospital, or even severely ill in the hospital, didn't quite need the ventilator and continue to have symptoms, probably you want to be evaluated at one of these centers.
Okay.
And there's actually a website called survivorcore.com.
Survivor Core.
Yep, survivorcorps.com. Dropping that in the chat.
I am.
Thank you. And this website is dedicated to helping people find resources to help them deal with COVID.
So you can go there and type in your zip code or something, and they'll tell you what places in the area can help you.
Yep.
That's great.
Yeah. So there's that, and
I spelled it wrong. Sorry. It's core, C-O-R-P-S.
Right.
Okay,
yeah.
I thought it was core, like your core.
Oh, okay, yeah.
Okay, sorry about that, everyone. It's survivorcorps.com, not the core.
Yeah. So there are resources there. But for people who are not as severe and maybe they go through the testing and, their pulmonary function tests are okay and their heart looks okay, but they're still suffering from fatigue, then probably those people need, an assessment by an integrative or functional doctor to see what's going on and see how they can be helped.
Great. So that if you are experiencing those, I guess, less severe symptoms, you can give us a call and get evaluated just with one of our practitioners, and we can put together a treatment plan to treat those symptoms and hopefully diminish them and reduce them as much as possible.
Yeah. I mean, again, you may have heard this before, Krista, but the foundation is always the same. Making sure you're eating a good anti-inflammatory diet, making sure you're getting adequate sleep. Probably if you had this, I would certainly say you probably need to sleep 7 to 8 hours at least. Making sure that you're, you may be tired, but at least trying to get your body moving a little bit, what you can tolerate.
Yeah.
And doing things to control stress, meditation, that kind of thing. So those basics are always the same. Getting out in the sunshine could be helpful.
Yes.
Increase your vitamin D level. All those things, all those core principles apply to this also. But then the people with long haul COVID usually need more than that.
Right.
And a lot of wellness therapies. But there's a gym over in Pennsylvania that offers infrared therapy and hyperbaric oxygen therapy. If I had long haul COVID, I would go over there and I would get some hyperbaric oxygen therapy, because that's something that puts some extra oxygen in your blood, and that can only be helpful in this kind of thing. So
yeah, no, that sounds like something that would be very helpful. So what was I just going to ask you? Is there anything else that people should know about long haul COVID that maybe we didn't cover yet?
Well, we call it long haul COVID, but everybody brings their own pre-existing stuff to the table, if you will.
Yes.
And so sometimes those other things are contributing, whether they're hormonal issues or whether they're toxin issues. So that's why you really need an assessment to see fully what's going on. And you can't just take a supplement. Not that we give supplements, we give supplements that help people with their mitochondria. We give supplements that help people control inflammation. And I would probably do that, and maybe in a minute we'll talk about more about prevention. How can I prevent myself from getting long haul COVID? But you really need an evaluation. Once you're in the long haul phase, you really need an evaluation to see what all the contributors to that are, so that you can treat all of those things.
Right.
Because if you just treat a piece of that, you're probably not going to get better. You need to treat everything. If you have long haul COVID, but you had a pre-existing inflammatory condition, you need to treat both at the same time, or else, you're just not going to make any headway on the long haul COVID.
Absolutely. We did have one question in the chat. Is this in any way like fibromyalgia or PTLDS post-treatment Lyme disease patients experience?
So interesting question, very good question. It is very similar to that. Many of the same processes in the body, the chronic inflammatory, the autoimmune, detox systems getting overwhelmed. Many of those symptoms are the same. Yep, the fibromyalgia, the chronic fatigue syndrome. Yep, those symptoms, the chronic Lyme, those symptoms all overlap and all have very similar underlying immune dysfunction, mitochondrial dysfunction. And so, that all has to be assessed.
Thank you. There is actually another question on Facebook. How do you get your stomach back on track specifically?
How do you get your stomach back on track? Well, we talked a little bit about the nutrition, making sure you're eating a good anti-inflammatory diet. It's kind of a broad question. I guess really, if somebody came to me and had long haul COVID and they were having a lot of GI symptoms, I would probably be doing, an advanced stool test to see what's going on, see how much inflammation there was in that kind of thing, and then probably do supplementation that's targeted at healing the GI tract. Making sure they're on a good probiotic, making sure that they have anti-inflammatories for their gut, things that are going to feed their gut lining and help that to heal, because if they're having GI symptoms, they probably have increased intestinal permeability, also known as leaky gut, which contributes to everything else going on. So you want to make sure that gets healed. So usually, people can read books on that kind of stuff, but usually it's better to get with a practitioner that is experienced at doing that. Help. But a good probiotic is not very unlikely it's going to hurt anybody. So I would recommend that people do that and see if they could get some good prebiotics, whether that's sometimes you can get that as supplements. Some of the probiotics will come with prebiotics, but putting things into your diet that are fermented, the sauerkraut, the kimchi, the kombucha, that kind of thing, can also be helpful for people.
Yes, and sorry, there was another question in our chat. Is anyone looking at vitamin D levels in the 60 to 80 range, or glutathione, perhaps via supplementation with whey, so the body makes what it needs?
We, in our practice, we try to make sure everybody's up above 50, for sure. So in the functional world, there's an acknowledgement that you should definitely have higher vitamin D levels, whether it's 50 or 60 to 80. Certainly it's not 30 or below. That's for sure. There are studies that show that people who come in below 30, when they compare them to people who are up over 50, those people who are under 30 had more severe hospital stays, more likely to end up on a ventilator, more likely to die. So that seems to me a pretty powerful endorsement of vitamin D. Um, you know, you can argue whether it's 50 or 60 or 80, but yeah, certainly about 50 for sure. That one study that I just quoted found the benefit to about 55 for those hospitalized patients. Um, so, so right between 50 and 60, if you will. And the second part is about the glutathione, and I use for people who have opted to get the vaccine. We're putting them on glutathione even before they get it to help with their antioxidant and detox systems for the vaccine. And it's also something that I use for people after, either during or after they have COVID. You know, if I can get them when they're you know, more in the acute phase, we'll get them on it then. But certainly afterwards, you know, put them on it then to try to prevent them from having long haul symptoms, because all that can modulate the immune system, modulate the inflammatory system, and that's what you want to do to prevent long haul COVID. So that's one of the ways that we're trying to help with that.
That's a good segue, actually, because this was the question that I forgot about before. I know we have a detox from the vaccination kit. So would that be something that you would consider using also for long haul COVID patients?
Yep. Yeah. That would certainly be a basis for it. Yeah.
Okay.
Yeah. The glutathione, the cytodetox, you know, glutathione, again, antioxidant, anti-inflammatory, powerful detoxification agent. Cytodetox, which helps bind things, so powerful detox agent. And then we use called Resolvins SPMs, serum protein modulators, or resolvins, and they're very powerful at decreasing the inflammatory response, modulating the inflammatory response so it doesn't get out of control. And then a specialized multivitamin that's very good at both helping the mitochondria and rebuild membranes, both the mitochondria and nerves, that we use for both the detox and afterwards. So yeah.
Okay.
All part of that.
We have more questions, so we're just going to keep going here. Same question back to the stomach. Wants to know, what does an evaluation entail other than a stool sample for the GI test?
It involves a stool sample. It also involves often blood work, looking at inflammatory markers there, you know, looking at the liver or that kind of thing. So that's usually between the stools, and sometimes we'll also do urine organic acid tests, because the organic acid tests, they have markers that are specific to the GI tract, looking at yeast and that kind of thing. So that's usually the main things that we do for that.
Okay, yeah, she's saying that 2 weeks out from the shot and her lymph nodes are still swollen. So I don't know if that's been a symptom that you've heard of, but
I have heard that some people have had some swollen lymph nodes and that they've persisted for a while.
Yeah. I know that women are told not to get a mammogram within 2 to 4 weeks of having this shot, or having COVID. I was talking about the vaccine, but probably the same way would make your lymph nodes swollen and then possibly, you know, make the test inaccurate. So
Yep.
That could be it. And then another follow-up question: do you check fasting insulin levels? I believe under 6, around 4.5 is better than the reference range.
Yep. We check. We have on the blood work we do. We have an insulin resistance score that checks both the fasting insulin and the fasting cystostatin, which is part that gets cleaved off the insulin, and we can tell how much insulin is being degraded. And it gives us a better look than even the fasting insulin. And totally, that level of 6, 4.5 is optimal. And yeah, that level that they put on the conventional blood work of up to 19. I mean, once you get much above 6, you're starting to tip into insulin resistance at that point.
Okay. Well, if anyone else has any questions, feel free to ask them now, but these were really great. I think we covered a lot of ground here today.
And I'm not going to tell people to get the vaccine or not get the vaccine. That's an individual decision, but it apparently is one way you can prevent long haul COVID is if you're vaccinated and you don't end up getting either COVID or, it doesn't, for some people, it doesn't totally prevent, but it seems that it is causing much milder symptoms. And it appears that those people are not getting long haul COVID like the folks who are getting the natural disease,
Got it.
that has not been vaccinated. So I'll let everybody make up their minds about vaccination. And if people want to have a discussion about that, we can have a discussion about that. But that's, I just wanted to mention that that's one of the strategies some people are using.
Information is power, and the more information, the better. You can make the decision, like you said, for what's best for you. But we do have more questions. So would you recommend S. Ballardi for gut health, which I think we definitely do, right?
It's certainly one of the ones on our shelves. Yeah, we use that, absolutely.
And then spore probiotics as well.
Yeah, what I like to do with my probiotics is rotate them often. I'll see what people have going on in their GI tract, and then choose my first probiotic based on that. But then I like to rotate things every 3 to 6 months, just because I don't think one probiotic is there are a lot of good ones. I don't think there is one probiotic that is the best one for everybody. So science is young, so I get around that by using different probiotics, S. Boulardii and the spore probiotics included. So
the more diverse, the better, right?
Yep, absolutely.
All right. Well, I think that is it. And again, I just think this was such a robust conversation. We covered so much ground. COVID is still with us, unfortunately. And, any information we can put out there for people, whether or not, they get the vaccine or they don't, this is good information to have, and just to know, what's happening with those folks who have gone through COVID, what they're experiencing. So thank you so much, Dr. Vinny. And we'll be here next week. And I think someone mentioned Lyme earlier, so we will be talking about Lyme disease. It's Lyme Awareness Month, so we'll touch upon all of that and how it affects our brain and cognitive function. Oh, we do have another question. Has IVC treatment for long haulers been tried?
I haven't seen any studies on it. I'm sure some functional doctors somewhere are doing it, but I haven't seen the reports. If they want to shoot me their email, I can take a look around and see if I can find anything.
If anyone has more questions, feel free to call our office. We're happy to schedule a discovery session to answer any questions you have about long haul COVID or anything else. Our number is 609-512-1468. And you can always email us at info@princetonIH.com as well. I'll put that number in the chat here. But thank you so much again. And thank you all for joining us today and for your amazing questions. It was a really great discussion.
If anybody's on Clubhouse, I'm going over to Clubhouse and talking about the same thing it's starting at 5 p.m. So
this is a great talk. Thank you so much, Dr. Vinny.
Okay. Thank you, Krista.
Talk to you soon. Bye, everyone.
Bye.